Welcome to this episode of Patient Perspectives in HIV, a CE podcast series. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practice.cme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Samantha Hill and her patient who acquired HIV during her adolescence.
My name is Dr. Samantha Hill, and I am a physician that works with and cares for people living with HIV in Birmingham, Alabama. And I'm sitting here with one of my patients today, and we're going to go ahead and get started. And so one of the first questions I have for you is, before you learned about your HIV status, did you perceive yourself to be at risk for HIV, or were you ever concerned about HIV? And if so, why or why not?
No, I didn't. I was only 12 years old. I knew it was a risk, but that was before learning that I was positive. I didn't have any kind of concerns about it.
Can you share a little bit about what led you to get tested for HIV when you were 12?
Well, actually, I was just going in for a regular checkup and just getting, regular tests ran. And the following day, I had ended up, my doctor had called and told me they needed me back in the office. And when I got back there, that's what they told me.
Okay. And what were some of your thoughts when the doctor said that you needed to come back in? Did you know what they were calling you back in about?
No, I didn't. At the time, they really was talking to my mom because of my age, but I didn't think it was coming in to get, treatment for HIV.
Okay. So did your mom know why you were going back into the office?
Well, not at the time when they called, but once we got there, they explained everything.
Okay. How did it feel having your mom with you while you were receiving that particular test result?
Well, I was 12, so, I needed someone there. She was a good support system. Didn't want her to find out that way. And I was scared after I actually found out what HIV was and finding out, the possible side effects and things like that.
And after you all left the doctor's office at that particular point in time, what were some of the things that you guys had to do next?
We had to do a whole bunch of tests. They actually tested my mom, tested my dad. They tested nigga. And of course, tested me again. They gave me a whole bunch of pamphlets and things like that.
Thank you for sharing all of that. That's definitely a very unique experience to you in the sense of having to be informed at 12 that you had HIV. In the months that followed that, what were some of the thoughts, feelings, things that you did as you adjusted to having a new diagnosis?
Well, of course, I ended up having to get counseling. Because at the time I just thought my life was just over. I got counseling, and she was another person that I got comfortable with talking to. Of course, I had adjusted the medication, and around that time I was going through my brother had just got killed, and so we were just kind of everywhere at the time.
Mm-hmm.
But I finally got adjusted to it maybe, I say, a year after. And it's just been smooth sailing ever since.
Okay. And is there anything in particular or any event in particular that made you realize, like, I'm going to be okay. I'm okay. I got this.
I didn't realize that until years after I had my son. So after I had him, a lot of stuff had changed and a lot of my perspective. I was the type to think, oh, I'm going to die tomorrow, I'm going to do this. But no, it's been very smooth.
And so when you got the diagnosis, I'm sure your healthcare provider talked about the need to start medication. What things were going through your mind when they had that discussion about starting antiretrovirals or medication for your HIV?
Me thinking I had to take a whole bunch of medication, and I have a problem with swallowing pills. And that was just my biggest fear, like getting the pills down and actually just taking them.
So what was it like when you actually received the medicine and had to start incorporating it into your daily routine?
Well, incorporating in my daily routine at the age of 12 was hard. I would take the medicine, have to go to school sick, vomiting, things like that, but I knew that I needed it. So it was a challenge.
And in addition to one, having a new medicine, and two, not really being comfortable swallowing pills, were there any other challenges with regards to your medicine at that time?
I guess just my body getting used to it. I had a lot of nausea and vomiting.
Okay.
And yeah, that's about it.
Okay. And about how long did it take for those things to go away, or had they ever gone away?
Never went away.
And then have there been any changes to your regimen for your HIV treatment?
Yes, there was a change due to the nausea and vomiting and the amount of pills I was taking. At first I was taking like 4 or 5 pills, but now I'm on a 1 pill a day, and it's working so far.
What have been some reasons that you've actually had changes in your regimen?
The amount of pills and just over time, it was just changing. Of course, the vomiting and things like that, and I do have asthma, so we had to change one time for that. I just rather take 1 pill.
And because I know you have actually tried a lot of different things, especially because of the challenges with swallowing. How did some of the medicines that were liquid compare to some of the medicines that were pills? Were liquid regimens easier for you, or?
No, the liquid, it might have been better, but I had to get over the taste first. But it still had me nauseated and stuff like that.
Yeah, I can imagine the taste, especially since you're an adult person, and usually liquids are dosed based on how much people weigh, and as an adult person compared to a child, you probably had a lot to swallow. There have been so many new medications that have come out to help people live long and healthy and successful lives while also living with HIV. And you and I both know an injectable medication came out maybe within the last year or so. What is that? What did that mean to you when you heard that there was an injectable medicine for HIV?
Well, I was saying switching to a long-acting injectable would free my time up from being sick, spending more time with my kids, and actually feeling like spending time. Of course, I won't have to take any pills. That will be an A+. And I feel like that the injectable will be real good for me.
What places or what resources have you used to learn more about the injectable, if any?
Lately, I've been doing my own research on the injectable. Then you all have given me little pamphlets and have talked to me about the injectable. And I've also going to visit the 1917 building to get a little bit more information and hopefully start healthcare with them.
Awesome. And the 1917 building is another one of our HIV clinics in town. Can you share some personal thoughts about what it's been like to, one, be diagnosed at 12, and then two, to be living with HIV for the last 16 years?
Well, my knowledge has changed. I know a lot more about HIV. Of course, forcing myself to swallow meds. I know that I have to do it. I have kids. Of course, a lot has changed because I was 12 and now I'm older. I'm wiser on it. And my health care and my health conditions is important to me now, more important than they was.
And then, final thoughts, just looking ahead to your life, the life of your family. What are some final thoughts you would like to share?
Well, I do know with more education, better ways to get treatment, you'll live long, a strong, thriving life. I've been living with it for 16 years. Everybody have challenges. Everybody, go through things. And your life is not over just because you're HIV positive. I got some good health care providers. I got the support I need. We just here trying to figure out things to do to make our life better.
I love it. I love it. And I appreciate you sitting down and talking to me today just about your experiences taking medicine for your HIV.
Thank you for listening to this episode of Patient Perspectives in HIV. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.